I tell my staff and also from the work I've done that the orthodontist is considered a record keeper. The record keeper meaning from the very earliest stages, we begin to acquire photographic and radiographic images. And jaw development obviously tracks differently for different patients. By accumulating this series of records from the earliest ages, not only can we offer customized treatment plans, but the ability to have serial records will help guide our decision making, gives opportunities for longitudinal databases for research and development, and also modifying our clinical work as appropriate. So ultimately, being a record keeper, being a quarterback about recommending timing for the dental specific type of treatment.